Now, I understand, and you've already touched on it, the new Goethes House Dementia Ward here at MACS opened last April. What capacity and facilities does it provide for residents?
So at the moment, Dennis, it's a 10-bed unit and it will go up to 14 beds. We're just refurbishing some other rooms in Barella House at the moment and using those last 4 beds as we move residents around to facilitate that. So perhaps I could tell you why it's called Goethes. Maybe that's a really nice one of your questions. Follow up. So Goethe came into our care back in 1994 when we first opened. And I can remember the day she came in with her children and she pulled me aside and she said, "Joy, I do forget things." And I said, "That's okay, Gerda, so do I sometimes." So she made the decision to come in to what was then Geelong Multicultural Hostel, wasn't even called Barella House. And she loved it. There was a lot of Dutch people and she loved the company. She loved the staff, the Dutch staff. She had a really great quality of life. Her dementia increased slowly over time, still very manageable for us to look after her. She eventually got to the stage where she would start her sentences in English and finish them in Dutch. And then her family, they had emigrated to Australia post World War II. All her children were born here, and such was Gerda and her husband's wish that they assimilate to the Australian way of life. They never spoke Dutch to them. So when Gerda eventually lost all of her English, she couldn't communicate with her family anymore. So their visits became less, which was, pretty difficult for her, but also for the family because they could no longer communicate with their mother. We could still cope with Gerda in Barella House because we had Dutch-speaking staff. But sometimes within her Dutch, she wasn't making a lot of sense. You could still manage her and care for her. But then her behaviours changed and she started to be at risk for herself and a risk for the other residents. She would get quite angry and quite frustrated. And it was a large building. Barella House was large and she would get lost and that would distress her and there was a lot of factors. So we had to have the conversation that we needed to move her to a dementia-specific facility. And it was very hard for all of us to have to transfer her out. And the day she left, I could see it in her eyes. She knew she was going somewhere. And we transferred her and she died just 6 weeks later, alone and culturally isolated. And then I said, this should never, ever happen again to a resident. They should not be isolated. And that was the push for our dementia unit. It took us a long time, another 20 years to get there, but that's always been our driver, to make sure that we could provide that safe environment for people in a unit that is quiet and small and whatever their behaviours, they're accepted for where they are. No one gets upset or angry with them, and if they ask the same question 100 times, so be it. You answer the same question 100 times. And given the size of the unit, it's just intimate enough that they get to know the residents really well. So it's a safe, secure and just a delightful little area to be cared for in.
And it minimises the dislocation to the individual as well, just going across the piazza to get there.
Absolutely. So some of our residents were already residents within our facility and we transferred them in there because they needed to be away from a 30-bed house into a 10-bed house. So families were delighted that that transition could go really easily as well. And the people in our dementia unit will have very minimal change over there because they're usually quite fit and active, and it's lovely to be able to care for them. And they can walk all the way around and be safe. They can't get out, so everyone's really in a secure place.
You provide services to elderly or disabled people in their own homes. How does that work?
So we've got 127 packages of care. That's Commonwealth-funded packages of care, Denis. 25 of those are up in the Western Metropolitan region, but mainly for the Vietnamese community, and the rest of them are around Geelong and surrounds. So there are currently 4 levels of packages that you can have care. Levels 2, 3 and 4, 1, 2, 3 and 4, so it's pretty. Level 4 being the highest, and that probably gives you about 10 hours of service per week, and down to level 2 and you might get 2 or 3 hours of service per week. And they're really goals orientated as to what the resident needs to be able to continue to maintain themselves at home. So For some people, it might be really important that someone can take them shopping so they can go and get their groceries. Others, it might be they need someone to get them to appointments. Some of them just like to have their garden done and looked beautiful and kept beautiful because that makes them feel good. Other people might be really important that they go to church every week. So they're very goal-orientated services that go in. We have to be very open and transparent with the money that we are managing on their behalf. So every package has a dollar figure and services have to be maintained within that dollar figure. And every month the families get a statement to say what's been spent and if there's any money left over and what they might like to do. But we can't buy things like food, or we can't buy televisions or new carpet or things like that. So it is very much goal orientated. Then we also have our private arm where people can buy, broker in or get private services. And of course they can be whatever you want to be. So sometimes it's giving someone a spell, and some people don't want the government to know what their income might be, or I know they just get a private service, and we can provide that as well. We also have a partnership with the Hospice Foundation in Geelong, and along with the Barwon Health palliative care team, we're able to provide services to people who are wanting to die at home, and we can offer support for overnight care. You know, the family might be exhausted and need a good night's sleep, so we can come in and look after their loved one overnight while they have